Next on Bodywork. If you look into my eyes, what do you see?
You're taken aback by their appearance.
Your breasts are so heavy.
They're huge.
I want big guns. I want big guns.
Where is that nipple?
Wow, Alice Cooper, man. Watch out, dog.
I can change my face. I can touch feelings. Just like you. I'm just like you. I'm just like you. I can't see home no more.
Miami's paradise, and we make paradise just that much more beautiful.
There are a lot of breasts by Herman out there.
Human beings have an innate appreciation for beauty. We want to see beauty.
It's very unusual to find 3 plastic surgeons who work together happily.
Over the last 5 years, we've all realized our strengths. My strength is I enjoy the media.
He's the media darling in our office. Every opportunity that he can get to be on television, to be in the newspaper, he goes for it.
Dr. Wolf loves the media, loves being the center of attention.
Dr. Wolf was on the cover?
Yeah. Wow. Dr. Wolf is a movie star. He's always on TV. He loves the cameras.
Hey, how you doing?
How are you?
Hey. I've been in the media for 15 years, and I've always understood that a lot of my patients who come in now, they do see me in the media, and that's why they come.
Hello.
Hi.
How are you?
Hi.
How's school? Want some milk?
Hi, Jessie. Hey, Jessie. Hey, Jamie.
Cleft lip and cleft palate are considered a terrible deformity throughout the world. And when you just look at these people, often you're taken aback by their appearance. I've done a lot of cleft lip surgery in the past, and I have a reputation for doing that.
The people told us the plastic surgery is excellent in Miami.
The Zhang family is from the Cayman Islands, and they were referred by a physician in the Caymans. They're a pair of twins, one of which was born with a unilateral cleft lip. The other was born with a bilateral cleft lip as well as a cleft palate. They don't have insurance, and yet they were able to raise the money with their friends and families to come up here and have the surgery done, which is pretty amazing. Hi.
Hi, doctor.
How are you?
Good. Thank you.
Good. How's the girls?
They're fine.
Good. Oh, I'm sorry.
Just hungry.
I bet. The first thing that makes the Zheng case unique is that they're twins, and yet they have different deformities. One's a unilateral cleft, the other is a bilateral cleft. It's not genetic, it's just something that happens within the womb while the baby's developing. We'll do the bilateral first, the harder surgery first, and that'll take me probably about 2.5 hours. Parents of clefts, they want to get the surgery done as soon as possible. Everybody wants to have a normal baby. Both of them will have the little arm restraints, but this is surgery, and it's surgery on a baby, and that's a risky thing.
We're very, very worried about the baby and nervous, because we don't know what's going on and how's the come out.
The great thing about operating on these kids is because they're little, they heal fantastic. You know, They always recover very quick. They all heal great. You know, okay? All right, great. They're trying to balance being excited, but at the same time worrying, is my baby going to be okay?
What I don't like about my face are the bags under my eyes, the tired look, the look that I haven't got any sleep. The look that I've been out all night drinking and partying, womanizing, which is not true. Miami is the place to be. You see VIPs, you see interesting people, you even see wackos like me on the beach. I consider myself one of the South Beach guys. I go to the beach about 3 or 4 times a week, take my long swim in the water, walk up and down the beach, people watch. South Beach is a fashion show. People are watching, people are looking, people are saying, well, who's that? How you present yourself, it's real important. I go to the gym, work out, and I try to dress fashionable. Recently, I had my teeth bleached, see? I can afford to take good care of my appearance from the income I make from my commercial properties and also with my online patriotic web store. Nobody wants to get old. We're all looking for the fountain of youth. We have surgery, we have special diets. Let's use it. Let's take advantage of it.
Dr. Wolf will be seeing patients this morning.
You know, it's our anniversary show. It's a big show.
On the red
the red carpet is this afternoon.
Oh, okay.
People in the office, either to my face or behind my back, call me El Más Famoso.
It's the joke that he's El Más Famoso. Everybody knows Dr. Wolf.
You think it's all a joke, huh?
You ready for this one? I think he's gonna wear it, huh?
I've had a custom-made bathing suit made for him, and on the butt of the bathing suit, it has the slogan of Carlos, which is El Más Famoso.
I think it's his size. It might be a little big.
He's going to have to stuff the bathing suit because otherwise he'll be a little embarrassed.
Oh, he's gonna love that. Oh. I think he'll look cute in that.
We should do something on South Beach and let him run in those.
Anything by El Más Famoso.
All I see is boobs. These big boobs, that's all I see. Men don't seem to talk directly to my face. They seem to talk to my chest. When I was a little girl, I was very, very thin. The minute I turned 13, I looked down and I'm like, where did these come from? The minute I got engaged and wanted to go out trying wedding dresses with my mom and my sister Monica.
How can we help you?
Oh, I'm looking for a wedding dress. Today's the first date that I'm gonna try on wedding dresses.
A little bit too busy here, don't you think?
No, I don't like this. I'm really not sure what style I'm looking for.
Very, very nice.
Love it. Yeah, I definitely want to try that one out.
You just want to come with me then?
Yeah.
Nicole is very sweet, very sensitive to the extreme.
Beautiful, beautiful, beautiful. So pretty.
When I stand in front of the mirror, all I see is boobs. These big boobs.
Oh, you know, it's not
coming out
size,
everywhere.
You know, that's not.
I don't see my face. I don't see my hair. I see these huge boobs.
No.
Like huge.
I don't like that. She says, I'm busting out. That's the way she phrases it.
Mom.
Am I busting out? You're totally busting out. Look at that. Look at that.
It's
How horrible.
No.
Zip it up all the way to the waist, and then that would be it.
Wedding dress after wedding dress that I would try on, it would not zip up. Nothing fits. That's it, Mom. I can't take it anymore. I'm so frustrated.
Nicole, please, let's not start with that again. She started with this whole surgery thing about 3 to 4 years ago.
Nothing fits her.
Nothing fits me. I've been thinking a long time about getting a breast reduction. I've always wanted to do it, but my mom gave me like 100 excuses why I shouldn't do it.
Honestly, my fear is the anesthesia, and it's the surgery and the scars. And
It's supposed to be like the happiest time of my life, and I'm hating it.
I know how she feels because I went through that.
Oh, you did?
I did. I
You had a
breast
breast reduction?
I did 10 years ago.
What
So
a
I
coincidence.
can, yes,
You can relate.
the most important day of her life, and if she's not happy,
Okay, then. Look into it then.
she's really gonna be fine.
I hope.
Take it from me.
The desire that I see in her to have this surgery has made me accept it.
It's not comfy.
The wedding's not yet. Don't cry yet.
We all have egos. And every once in a while, if we can improve on our ego, why not? And this is one way of doing it, having some plastic surgery.
Hey, how are you? Good seeing you. How can I help you today?
Well, if you look into my eyes, what do you see? What I see...
That sounds like a...
What I see is
Okay.
tired eyes, baggy eyes, and if I do something like this, a little younger, huh?
Yeah.
So this is now, and hopefully in a few months, it'll be like this.
He wants to straighten out his eyes like this. And very often in patients, these two fingers can do much better than surgery. There's two things going on in your eyes. This is one, and this is another. He has actually two sets of bags, one right underneath the eye and one here. And this isn't like a bag, like you see the traditional bag. Eye surgery will not get rid of this right here. These are like festoons. Part of that has to do with his genetics. Part of it is he's a sun worshiper. Now, you spend a lot of time in the sun, right?
Yes, I do. How'd you know that?
Well, I'm very observant. You know, maybe the dark skin.
5 years from now, yeah, I may have more sun damage, but I don't know. Hey, are we all going to be here 5 years from now? I want to look good as soon as I can.
The incision is going to go right underneath your eyelashes. Men don't want to look operated.
No, we certainly don't.
I have a fair amount of men in my practice. Listen, I can tell you something about men.
Let me take a couple pictures of you.
If they're having surgery, I know that we're going to be seeing their young girlfriend eventually.
I'm Robert's wife, Lorraine Riel. When Robert first told me he was getting surgery, I said, you don't need it, you look fine, you look great. We had been having trouble in our marriage, and I think that, maybe he thought this would help.
Right now I'm separated. It's been about 8 months. I'd still be doing the surgery if I wasn't separated. Plus, I have small children. And when I go to these PTA meetings or whatever, I kind of look a little old compared to the other fathers.
Eyes really make a difference. Make you look tired or not tired. Robert's motivation for surgery, unlike a lot of patients, is not clear to me.
Thank you for your time. It's a pleasure.
Nice talking to you. And then we'll, and again, anytime you need any questions, you'll call me, okay?
Just like.
Here for surgery today?
Yes. The Zhang parents were extremely nervous, probably the mom even more so than the dad. You're having your most important possession in the world, your child, going in to have surgery at 6 months of age. It's got to be a very scary, scary thing. How are you? Good, good. How are you doing? She's sleeping?
She's sleeping.
But we'll take good care of her. And I'll come talk to you after we're done. Okay.
Don't worry, she's going to be fine.
When children are babies, they're so vulnerable. The risks with anesthesia in a baby are much greater. The anesthesia care has to be optimal because putting a baby to sleep is much more difficult than even putting a small child to sleep. It's the most important part of the surgery. You've got to make sure that when all's said and done, you're giving a healthy baby back to those parents. Ready?
I'm just like you, I'm just like.
Ready? Operating on babies, the stakes are higher. Babies are defenseless. The Zhang surgery was an interesting experience. It's very rare for me to do 2 cleft lip surgeries on the same day. This is actually a pretty small cleft. Doesn't extend all the way to the front of the palate. Scissor? A cleft palate is actually a hole in the roof of the mouth. If it goes unrepaired, the child will have difficulty speaking correctly. You have to make a little back cut. Make an incision along the edges of the palate, free up all that tissue so it can slide together in the middle. That's pretty easy cleft. The cleft lip, it's a hole in the lip. Bilateral is obviously more difficult to repair. The 2 parts of the lip are supposed to come together, and if they don't quite make it, it leaves this gap. What we do in surgery is we bring those 2 sides together. Well done. Hey. How are you? No problems, no bleeding, no nothing. Look perfect. Okay, just what you want to hear.
Yeah.
So 1 down, 1 to go.
What's up, everybody? Girls, everything okay? I go to the gym 3 or 4 times a week. That was a good bicep workout we did. I have friends at the gym, quite a few friends. Ladies, I need your opinion. I'm going to have my eyes done by a plastic surgeon. I'm going to remove these tired bags under my eyes. What do you think about a guy having his eyes done?
It's okay, yeah.
You think it's okay? Would I look more attractive?
You already are.
I think men emotionally are huge babies inside, very self-insecure. Like that sound? I love it. Some of the guys at the gym think about my surgery that it's really a girl kind of stuff.
You want big guns?
I want big guns.
Okay, come on. Because he's so aggressive guy, so tough. He's always like a no word about nothing. Now he coming to me and telling me, no, I want to do in the little wrinkles here. It's like, oh, hold on. What's going on here?
I think Robert's going through his midlife crisis. It was funny, though, to hear that he was doing plastic surgery. What a girly kind of thing to do.
Robert, he's a personality type that all of us in plastic surgery deal with. No matter what you say, he's always going to think it's going to be a little more.
So I'm going to go ahead and do it.
I try to make sure that his expectations are within reasonable range.
I'm going to do it. 7 o'clock in the morning. I'm having it done.
In his case, my worry is not his medical health. It's more his mental health and how he's going to respond to the surgery.
I see myself on my wedding day with a beautiful dress, feeling like a princess.
Right in here in this room, go ahead and change for me.
I think that this surgery is going to change her life dramatically. Having large pendulous breasts like this is really a hindrance. Hello.
Hi.
How you doing?
I'm doing great.
Good to see you.
See you?
You all set?
I'm set.
You ready to do this thing?
I'm ready.
I think every man out there thinks that he's a breast expert, but they're not. I am. Okay, let's take a peek here. My favorite part of the body to operate on would definitely be the breasts. It's the majority of my practice. Your breasts are so heavy. I know, like I had to tell you that, right?
It's horrible.
The plan for Nicole is to go from the double D that she is down to about a C cup. The idea is to make her proportionate to her body. Where does your back usually hurt?
This.
Right behind your neck and that whole area here. You can feel it right here, the pressure.
The back pains, the neck pains.
You're like ready for this, huh?
Oh, yeah.
Big time.
Big time.
Big time. All right, we're all set, okay?
Great.
I think that the cleft lip and cleft palate are as difficult procedure as there is in surgery. You really have to have an artistic eye to do it well. The second child, who was the unilateral cleft, which should have been simpler, was difficult. Scissor? She had a lot of excess vermilion, which is the pink part of the lip, that I had to deal with to make that transition from one side of the cleft to the other very smooth. We had to address the deformity of her nose, which was really slumped down on the cleft side, and we had to get that up. About 2 more stitches and we're done. Thank you. Turned out to be pretty challenging, but after I was done, I was real pleased with the way things turned out. That's the hardest thing, to get this to be smooth right across the top. So everything went great. She looked perfect. Oh, what a cutie.
We hope our baby after the surgery will be like normal baby and everything's come out good. Dr. Kerry is a very good doctor.
Miami Plastic Surgery, Liana speaking. How can I help you?
To encourage you for your next triathlon, we have a little gift for you. Okay? And this will spur you on to a faster finish, we think. You gotta have the right equipment.
It's a little small. El Más Famoso is the most famous. I'm going to wear this tomorrow under my dreams. Even though I get called El Más Famoso, it's not really my style.
You get the package in there.
It's a little small. I like the media. I like being out there. But I don't really feel like El Más Famoso. Clearly, small is not the right thing. I'm really pretty subtle. I try to be subtle. And somehow I can't be subtle anymore. Thank you.
You're welcome.
Thank you.
Wear it in good health.
Hey, Jay, how are you?
Good, how are you, brother?
I'm taking a limo because I hate driving in Miami. And plus, it's a good 45-minute drive from the beach to Miami Plastic Surgery. I'm going to have these bags under my eyes removed. I am feeling a little anxiety, a little nervous. I'm thinking about my kids.
Robert may be in a state of limbo right now. We got separated a few months ago because I just needed time to think. And he said he would give me time and see where we would go from here. I promised him that I would take care of him, you know, during his recovery from this surgery. Just because we're separated doesn't mean I don't love him. So I am here for him, and of course I'm going to take care of him and wish him the best.
How you doing?
Oh, hey, Doc, how are you?
Great.
How many cups of coffee have you had today?
None. I don't drink coffee.
Okay. Did you get 8 hours of sleep?
No. If I get 8 hours of sleep, then I'm no good.
Are you motivated? Is this going to be your best surgery ever?
You know what? You're only as good as your last surgery. So everyone is a souffle.
Okay. I like that.
Okay. That's to you.
That's what's going to happen, huh?
Surgeries do scare me because there's always a possibility of something going wrong. And it could be something very, very serious, like not waking up. And that really petrifies me.
Off to La La Land we go, all right? Start counting.
Take a good dream and go there, and then let us know all about it in the morning.
8, 7.
And you may be wondering, well, why am I going through this surgery?
5.
I may not wake up and never see my kids again.
3. 2.
I'm just like.
What was the last one?
What was
that? That
just like you. I'm just like you. I guess we all want more.
2.
What was the last one? He's out. He gets a 2.
You got the 2.
You got the 2?
That's it.
I'm operating on Robert Real. He's going to have his eyes done today. Robert is an exorcist at this time of day. Right, Robert? Yes, it is. I was going to ask him if this was real tan. Okay, so here we go. We're going to start. It's going to bleed a little bit. I'm going to remove the upper extra skin and the fat in the middle. We're going to remove some of this so he doesn't have that real prominence underneath his eyes. A lot of extra skin here. I'm kind of surprised. Let me see his picture, please. Can you just grab it? He's got that big muscle band. Now we got to get into the muscle. If you look at really muscle right there, I took some of that out and a lateral fat pad. That just thins the skin out a little bit and it gives him better contour. Okay, let's go to the lower. I think that Robert's eyes, there's certain limitations of what I can and cannot do, and I've made it very clear to him. The one thing that he won't be able to accomplish is he's got like little festoons, and that area might improve somewhat. The reality is that he may not improve there as much as he wants to. I think we're okay. I mean, really. What I'm going to do is do closure. As long as there's no bleeding, then we'll be out of here. It's always amazing to me. All these surgeries, they just walk right out. I mean, it is really amazing.
Robert, rise and shine, buddy. You're going to have to help us move, all right?
The overall effect will be to lighten that heaviness in his face. And then I'm sure that he'll probably want to go ahead and do some other things.
Wow, what a trip. Wow. What a trip.
Robert, you did great. Open your eyes for me.
I see 2 of you.
Do you?
And I really do.
You guys probably still the medicine you're on. I think it's going to be real good. You want to see what it looks like?
Yeah, can I?
Here, take a look. See, even though you're swollen.
Wow, Alice Cooper, man. Watch out, dog. It's not unusual to be low.
All right, we're going to put you in the wheelchair and wheel you over.
Oh, I love this attention. This is great. The you around me, I love this.
I can hear him.
Look what it did to me, honey.
Oh, honey, like the old days.
Now are you seeing just one of me now, or is it 2 still?
No, 1 now.
Perfect.
Don't be late tonight, okay? I'll be there holding your bar stool.
Robert, he's the type of patient that if things go extremely well, he's going to be out the door jumping around in 3 days.
It's not unusual to be...
We're going to go back to Lorraine's house. And unbeknown to Dr. Wolf, my little girl is in a talent show at school. She's been practicing very hard. And I'm going to go see her. I have to go see her.
Just got done with surgery, and here you are, dressed and ready to go.
Yep.
Now, Robert, I want everything to go well. I want everything to go well. You've got to take it easy. Relax.
Nicole showed up for her pre-op. She brought in tow Mom and Danny, her fiance.
Here with my mom,
Yeah.
Tika.
Good to see you. Hi.
And this is my fiance, Danny.
Hi, Danny. When are you guys getting married? You know, enough is enough here, right?
November 6th.
All right. Congratulations. How do you guys feel about this? You guys all set?
I've really wanted to do it for the longest time.
If any guy ever asked me why I would want Nicole to get a breast reduction, then I'm the stupidest man alive because, hey, that's a guy's dream. I've got Pam Anderson next to me. I'd ask him if he's ever really loved a woman, because when you really love somebody, you want what's best for them.
I understand that you are the opposite of everybody else in your family.
Sham.
You got to go the other way.
Yeah, definitely the other way. My daughter Monica and myself, we got breast augmentation 2 years ago.
What? You guys are insane.
She just could not believe that we were going through this process.
It was totally beyond my comprehension why they would ever want to get breast augmentations.
You guys are absolutely crazy.
Hello, don't you see how I suffer every day?
We just didn't pay attention to her. We were never going to make them as big as hers.
They got gypped and you got too much. It's just, life isn't fair.
There's no
right?
happy medium.
It's a shame we couldn't have done a transplant.
I would have a line waiting behind me for the augmentations.
Hey, how are you?
How are you guys?
Good to see you.
How pretty. The Zang babies recovered fantastically, and they're eating, and they're healthy, and they're happy. And this one had the bigger operation. But see, you can start seeing how I made some fullness there in the center. Let's look inside her mouth, too. I always love operating on babies because they're all geared up to heal. Her palate looks like it's already healed. That looks fantastic.
Yeah. Look at her nose. It seems like still not.
Right now she's very swollen. Things will get more and more symmetric as she heals. Get better and better and better. They're going to do great. They're going to look fantastic. Yeah, okay. It's very rewarding for me to see both the correction of the deformity as well as the happiness on the parent's face after it's done.
Okay. Thank you, doctor.
You're going to do great.
Have a good day.
Good luck. Okay. All right, sure.
Hi, Carlos. How are you today?
Great. Here to see Cherie.
Sure.
I try to take care of myself so that I look reasonably good. It is part of what I do. It's the package. Hey, Cherie. How you doing? Good seeing you.
Carlos is a wonderful man. I've been doing his hair a really long time. When they see him in the salon, clients are always talking about his work. Do you want coffee or are you okay?
I'm fine.
So what's going on with your life? You been doing any TV work? I see Carlos on TV a lot. You know, you open a magazine and there he is. I think he is the most famous. El Mas Famoso.
You're the pulse to Miami here. Has the Xanax run out yet?
The Xanax ran out. I'm like sucking the bottle, trying to find some residue.
Cherie is absolutely hilarious. I like to listen more than I talk, and that's unusual with me.
So my mother comes, right? I'm telling you, it's not easy. And you know she wants to move in with me. I'm thinking if she moves in with me, I'll never have sex again in my own house. So do I not take my mother because of my social life? It's amazing to me how popular he is, and he still has a sense of himself. And he hasn't lost that. I said to her the other night, I was going out, I said, don't wait up for me. I didn't come home till 12 o'clock the next day. And I'm like, hey, Mom, it's me. Thank God. I was just calling the police. I just have fun because I feel like he works so hard and he's so busy that it's kind of giving him a little break. Then I met this new guy. So I've been hanging out with him, and he's 38.
You know, you must be low on Botox then. Bye, Cherie. Take care.
Handsome.
Thanks a lot.
Dr. Wolf, I'm sorry, but I gotta see my daughter.
And I'm the accomplice. Sorry.
A lot of patients lie to their doctors.
Doctor's orders.
It does put them at risk, and it puts you at risk. I think any good surgeon wants their patients to have good results.
Sandy's gonna be singing, and our two little boys will be next to her holding the flag. I'm in pain and discomfort, but you forget all about that when you see your flesh up on stage performing.
Ladies and gentlemen.
You guys were so good.
Thank you.
Oh, Sandy,
your
you
man,
did
Max,
wonderful.
Spider-Man.
All right, who wants pizza?
Me.
Me?
Robert is like my fourth child. I didn't want another child.
My day job is keeping my wife happy and my three little ones happy.
Yeah.
but I enjoy it.
I'm glad you do.
I bet you do.
The ideal situation would be for Robert and I to be back together. I want things to be a little different, so really, you know, the ball's in his court. Come on, guys.
It's gonna change me. I'm not gonna be Nicole with the big boobs. They're not gonna be able to describe me. Yeah, Nicole, the short one, you know, the one with the big boobs. Yeah, you know her. It's not gonna be like that anymore.
Nervous?
I'm nervous. Think of bikinis, bathing suit, tank top.
Nicole?
Hi.
Hi there. I'm going to take you in now and start getting you ready. Come with me, darling. Okay, so you're
I've been looking forward to the surgery, or what it seems like forever. It's been a very long time. I can't believe it's already here.
How are you? Good morning. There's the smile I remember.
How are you?
Good. How you doing? These are my tools from the hardware store.
Okay.
The challenges with any breast reduction is to get them even. We spend a lot of time doing the drawing. This is about how high your nipples are going to be.
Oh my God. Are you serious?
Yeah. Okay. I'll see you inside a minute.
Thank you so much. I'm very nervous right now. Very, very nervous. My mom is probably the most nervous.
I'm worried, but at the same time, I'm overwhelmed with happiness because she's wanted this for so long. Be strong. Mom. You're gonna be the best.
Are those tears of joy? Piece of cake, okay? 2 pieces of cake. Nicole and her family are a little bit emotional this morning.
Okay, we'll take good care of her. Don't worry.
Yeah.
Sometimes the anxiety brings upon all kinds of emotions.
I'm scared, I'm terrified, and I think to myself, is this the right thing? Am I doing the right thing?
You're scared of the risks of any medical complications, heart failure or something that's going to go wrong, and something might happen to Nicole.
It will be probably the longest 2.5 hours of my life.
You happy going in here?
I'm just like you, I'm just like.
We're going to be doing a breast reduction on Nicole. She's right now about a 36 double D, and the plan is to get her down to a C cup. We're going to be taking off probably a couple of pounds on each side. She keeps saying, oh, I want to be small, I want to be small, I want to be a B, I want to be an A. I'm like, you don't know what an A or a B cup is. Whenever you do a breast reduction, there's always that unknown, what you're going to find inside. You don't know how firm the tissues are going to be. It's like opening up a can of worms.
She has really thick skin, huh?
Yeah. With her, we found incredibly firm breast tissue, which is really very difficult to shape, and it makes getting the symmetry pretty difficult.
So make sure we get the amounts really even.
The minute that I saw her in there lying down on the gurney, I freaked. I really did. I'm very scared. And I just hope she walks out okay.
I just want to know that she's okay.
One nipple down, one nipple to go. This one's a workout. Hey, Linda.
Yes,
you heard that Gwyneth Paltrow and her husband named their child Apple?
I did.
And his name is Martin, right?
Martin.
Apple Martin. It sounds like apple martini. I'm going to name my kid Banana. How about Kiwi?
Kiwi.
Right, Mango. Mango Capata. Papaya Capata. Pomegranate Jaramillo. Papaya Capata. Where's that nipple? Oh my God. We close the whole breast up, but we leave the nipple inside, and then we make a little opening for the nipple to come out. We made the opening, and then I'm inside looking for the nipple, and I couldn't find the nipple. You know I left it in there somewhere. Did you see it anywhere? Is there the possibility that I removed her nipple by mistake? Where is that nipple?
Dr. Wolf with thongs reversed.
They're not thongs. They're not thongs. They cover here.
It was in reverse.
I don't wear thumbs.
He did once though, a leopard print. Only once.
No, I
Only
did.
once.
I would never.
Dr. I'm kidding.
Yeah, excuse me.
I'm kidding.
Hey. How you doing?
Good.
Great. I'll be with you in a minute.
Okay. People say when you come to Miami that everybody's beautiful.
You put on some numbing cream. It takes like 10 to 15 minutes to take.
Miami has the most beautiful men. Go to a little jazz club, have a drink, and before you know it, you made 5 friends. And if I looked really old, I don't think they'd approach me or talk with me.
Hey, Sherry, how are you?
Hi, Dr. Carlos gives me Botox. I wasn't liking the way my face was starting to look.
Now, this stuff that you have on here that you can sort of peel off. And you
Don't
peel
make
off
me
for
be nasty. I was gonna lick it up.
Oh,
We have that flirty little fun kind of relationship, you know. He's just so cute.
Oh, this is kind of quick.
One of the reasons I get Botox is so it kind of slows down the aging process for me.
Since we've been doing this, your boyfriends have gotten younger and younger. Is that not true?
Well, do you remember when we first started? It was because I was getting married.
That's right.
To the 25-year-old. And you said to me, oh, you should do this. My husband was like 22 years younger than me. I just didn't want people thinking, you know, he's with his mother. Which I could have been, I guess. I asked them, are you still going to have sex with me when I'm 60? And they're like, hell yeah. So you better not retire.
Great seeing you.
Bye-bye. I love you. Thank you.
Take care. My pleasure.
Okay, I'm a new woman.
Where is that nipple? I couldn't find the nipple. Left it in there somewhere. There's always that split second where you second guess yourself. Oh my god. Because I saw it. Here it is. Whew. Moment of panic. I'm like, okay, relax here for a second. It's got to be in here. And sure enough, after a few minutes, we found it. I literally couldn't find it in there. I couldn't find it. The CSI Miami, right? The case of the missing nipple. Looking good. Done. Nicole's surgery went great. We were able to reduce them, incredibly symmetrical. Hey, boy, you got a whole credit. She's fine. Everything went great.
Yeah?
Yeah, they're just waking her up. When she can identify the planet that we're on, then it's time for you guys to come in. How does she sound?
Yeah, definitely. The worst is over.
Nicole took it pretty hard. Combination of the pain medication and the anesthesia really didn't settle with her very well.
Nicole, don't force it. It's going to come up on its own. Oh. You look beautiful. All right? You're going to be very happy.
Yeah, good.
You look gorgeous already.
She is gorgeous.
He's more miserable from the nausea than from pain.
Wants to go home and go to sleep, right? Yeah.
Ah, my charts. Let's see what we got here. Good patient, nice personality, very outgoing.
Who's this guy? Breesy. I thought Robert was here.
It's me, Doc.
This is
Doc
Snoop
went
Dogg Snoop Noop. Yo, man.
Doc, I'm double parked outside behind the ambulance.
Yo, man, you drove here?
Yeah.
You took your little coach here? Oh, yeah, you look good.
And it was terrible yesterday. My eyes were like real puffy. And today, much better.
His skin has been abused by the sun, and so I suspect that he will be more swollen for a longer period of time. What did you do here? Have you been washing your eyes?
What happened to his stairs?
Yeah. You cut them out?
No, I didn't cut them out.
Oh, they're gone.
They fell out.
Come on, these things don't fall out.
No, they did.
It's unfortunate. A lot of times patients just do what they want to do, and if there is a situation or a problem, then they say, well, doctor, look what happened. You cannot scratch your eyes, okay, because you're going to open them up. Yo, man, I tell you, he's got that whole south beat. He's got it all down there.
I want you to get with the program. So here's a beanie hat.
Thank you.
A little lower. Let me see that. There you go.
Thanks a lot. I appreciate it.
Bye-bye, Doc. Don't forget to write. Call me if you want to talk.
There's always that moment of truth when a patient first sees what they look like.
I'll be right with you, okay?
You get a knot in your stomach every time that this happens because you don't know what the patient's reaction is going to be.
It's me. Do you hate me today?
Oh, I
No?
actually love you.
You okay?
Love you.
As soon as I walked in the room, I could tell by the look on her face that she was going to be happy.
Oh, you look great. I'm just going to touch a little bit. What a difference, huh? You can't believe it, right?
After the surgery, as soon as I got home, I'm like, Mom, I gotta see myself.
Everybody, we were all dying to see her. We took off her bra, and we both stood there in front of that mirror. I almost fainted.
I was in shock.
Such a drastic change in her.
That's when I really realized how huge my boobs were before.
All right, you're welcome. Congratulations.
I think Nicole's doing great. I think she's very happy that she decided to do this. I think she's going to get on with her life now and enjoy it.
Yes.
I can my face. I'm just like you, I'm just like
It's only been a month and 3 weeks since my surgery. I notice a little difference. Very little difference right now when I look at the mirror. Not as much as I would hope for. I get some of my friends have said you look like 10 years younger, but I don't believe that.
He went into the surgery thinking, I am going to look 10 years younger. And, you know, it doesn't do that.
2, 3.
It's still swollen, still puffiness. Dr. Wolf says you have to wait at least a good 6 months. So I have to be patient and wait to see the results.
Lunch is ready. Come and get it.
During the recovery period, I was here for a good week, and it was nice. Being the father here and husband here and the responsibilities that come along with it. It felt good. I missed that. There's always a chance we may get back together. There really is. And you know what? I hope we do. I want to be a part of this family 24/7. Some things have to change.
I'll find you and Daddy your swords so that you can fight on the trampoline.
I am a fourth child sometimes, and yes, I need to grow up a little bit, but sometimes we want to be kids inside. We want to laugh, we want to crank the music up loud.
You look amazing. Oh my God. Gorgeous. Drop dead gorgeous. That's all I've had to say.
It feels fantastic to be able to get into a dress and
zip it up.
Zip it up. And it's only been a month and a half and it's incredible. I feel good inside and out. I feel so much better.
Am I glad I backed you up on this one? I'll tell you that much.
I saw my before pictures. I cannot believe I was this big. Look at the difference. Incredible. I'm so happy.
She looks good and she knows it. She walks with her head up high. You're a beautiful girl. And now with that body?
I look at myself in the mirror and I'm like, oh my God, they're great. I'm so happy. I feel like I'm looking forward to my wedding now. I want to dress up. I want to put on makeup. I want to look pretty because I feel so much better about myself. I love this here.
The tiara, out of hand. And this is the veil that I've always wanted for you.
Mom.
That big, beautiful smile that she has, to me that's worth $1 million.
I think this is it.
Yeah?
I mean, from head to toe.
From head to toe. From head to toe, really.
I have a CD of pictures from the Zhang twins.
Oh, cool. The Zings are at home in the Cayman Islands. It's been 2 months since their surgery.
Oh, look at when they started.
Oh my God, they're so beautiful. They've gotten so big.
Yeah.
Their lip balance is perfect. The children look fabulous. Their lips look awesome. This is one of the twins. Remember the ones from the Caymans?
Oh my God.
Yeah, both,
unbelievable. The cute kid, huh?
Cute.
This one was interesting because he had a bilateral complete. The other was just incomplete unilateral. So you gotta wait for their scars to settle down, but they will. Those scars will be flat, another 6 months. I don't really worry about the scar itself, because I know that's going to settle down over time. They'll continue to look better and better as the redness of the scars fade out of there.
That is great. Wasn't that great? Yeah.
Awesome.
I love doing these surgeries, and when I see these pictures, it just makes me feel good.
I can change my face, I can touch and taste, just like erase, just like with a little string. I'm just like you, I'm just like, I'm just like you, I'm just like, I'm just like you, I'm just like, I guess you own